Hello, I'm provider Danica Blosin, and I have a banana in my emergency waiting room right now. It looks like he has a pretty bad cut, so I'm going to take you with me and show you how I would treat it. But first, we need to get ready. It's good that I already have my hair up. So now, super duper important, I need to wash my hands. It is key, especially when working with a patient who has an open cut or wound, to keep a sterile field, and that means keeping my hands clean. All right, everything's clean, so let's go. So the first thing that I'm gonna do is I'm gonna take this sterile cotton pad and I'm gonna try to stop the bleeding using pressure. Now I have an alcohol prep pad. I've cleaned out the blood, but that doesn't necessarily mean it's clean. So using this alcohol prep pad will make sure that there are no more germs, bacteria, or any other debris that might get trapped inside the wound. All right, Mr. Banana, I'm so sorry that I wiped some of your face off and that alcohol must have hurt, but don't worry. I have some of this local anesthetic. It's called lidocaine. I'm going to quickly inject this in your wound and I'm going to do a diamond pattern just so I can get all of the areas numb around your wound. So I have to open the wound up a little. I'm so sorry. Get right just below the skin and inject a little bit there. A little bit here, and a little bit here. So the first thing I'm going to do to you, Mr. Banana, is something called an instrument tie. You can think of it as like an anchor. It makes sure that I don't lose a thread or the needle inside your body because that is very, very dangerous. So the first thing I'm going to do for this tie is that I'm going to wrap the thread twice around my forceps, my tweezers. I'm going to grab the short end, the thread, and pull it together and twist it to make sure that it stays in place. So what I'm doing right now is a technique called a simple running suture. This type of suture is quick, it's efficient, and it's pretty easy to learn. It's perfect for the type of long, clean, straight laceration that Mr. Banana here has. It evenly distributes tension across the wound and makes it so that there is no foreign material or debris that can enter it. Now that I've got you all sewn up, I am going to place some of this sterile cotton pad to cover up the sutures. I want to make sure that nothing gets in, nothing gets out, and it stays all clean. Then I'm going to wrap this with some gauze. All right, Mr. Banana, you're all good to go. Look at that. Make sure that you take care of your wound. Let me know if there's any redness, swelling, pus, or if you have a fever, and you can come back and I'll see what's going on.